Thank you, Secretary Kennedy. This is the most powerful executive order on pharmacy pricing and health care ever in the history of our nation. And it's only happening because we have a president with the fortitude, the guts to stand up to the withering criticism and lobbying that's going to occur as soon as folks hear about the executive order. So on behalf of the child in Philadelphia who's got an autoimmune disease with a $1,000 a month drug, or the older woman in Los Angeles who's on a blood thinner who can't afford her copay, I want to thank President Trump. God bless you for having the guts to take on this industry. Thank you, sir.
Thank you very much.
So let's talk about the details a little bit. And this is primarily about equalization, as President Trump said. It's about fairness. Think of NATO as a metaphor. When President Trump said, you've got to pay a little more so it makes sense for all of us, they came up. And the European countries contributed. The same thing we believe will happen in this situation. Most people who have thought about this process agree that it is patently unfair to tolerate the numbers that Secretary Kennedy and President Trump have reflected to you. On this chart to my left is a list of the 10 drugs that were negotiated in the IRA. Again, this is the bill, the law, that regulates a negotiation process. This is the best price that was able to be obtained by the Biden administration. And if you look at these numbers, they actually reflect how much on top of the most favored nation price was being paid by the United States. So the closest to me, Bob, you can point to the chart, it's the closest one, 289%, the one that's closest to you. That means that we are paying in America 4 times more than that drug costs in other countries. Again, 100% is the baseline. It's 289% above that baseline. It goes all the way down to where we're paying 50% more than any other country. That's the range. As was pointed out by President Trump, half the time we're paying 3 times more than is paid in other countries. It doesn't make any sense for the system. That stated, President Trump has over and over again indicated, and Secretary Kennedy reflected as well, we want innovation. We want our technology partners doing the best they can to make the best solutions for drugs to cure as many people in America and around the world as possible. By getting our allies to pay a bit more, as they should be, and they should have for many years been doing, will course correct a problem that's gotten out of hand. And by doing that in a thoughtful, effective way, we're going to be able to get the pharmaceutical industry whole. Those jobs will still be here, will still be productive, will still be curing cancer and a slew of other ailments that plague humanity. America will still be the leader in this space, but we're paying the appropriate amount, the right-sized amount for those tasks. So over the next 30 days, the 4 of us up here, together with people standing in the back of this room who are doing a lot of the heavy lifting, are going to be approaching pharmaceutical companies to talk specifically about what we want the most favored nation price to be based on the best data we have. We're looking forward to a thoughtful interaction with these corporate leaders, many of whom we've spoken to and in quiet will agree the system is not right the way it is. They're patriotic Americans. They want what's right. But the fact that in my lifetime, as Secretary Kennedy said, for the first time, we have a thoughtful and aggressive approach, thanks to President Trump, on taking on the special interests, should give
which is
all
to
Americans
take care of the American people.